etc. And Dr. Anil Kumar Ram, colon, scanning and preventive care. Dr. Ulhas Deven, diagnosis and controlling measures for DM, HTN, etc. Dr. Shekar Raj, pediatric specialist. He is working on this topic and he'll be talking to us about it. Dr. Sudha Prasad, COVID vaccines, boosters, etc. And we have Dr. Sudha Kannavar, abortion, contraceptives, and vaccines for any cervical cancer, etc. So I request all the doctors to please come up on the stage and continue the program for us. And I request all the audience to please maintain a bit of a silence and make your kids sit down in a place so that we can continue the program without any obstacles. Thank you.
Dr. Amaresh and team, please.
Welcome back. After lunch and all, I'm sure you all had a good break. So, as the proverb goes, health is wealth. Arogyame bhagyam. So, ನಮ್ಮ KBA group we have so many well-trained, very experienced physicians in the different specialties. So, even amongst the attendees, we have so many doctors. So we thought we would utilize this opportunity and share some of the health tips. So because of the time constraints, we have chosen about 7 physicians from different specialties. So each one of us will be talking about 5 minutes to give a general health tip from each specialty. So most of the health tips, this is kind of de-emphasizing and advising. So, I will go in the alphabetical order. So, I will go first with my name Amaresh. I came here about 28 years back. So, I practiced as an interventional radiologist for 17 years. So, the last 13 years I was at Duke Health System, the Duke Regional Hospital. So, during the course of my practice, I developed a keen interest to do the stroke management. So with given the stroke trials and things like that, so I developed a keen interest, and so fortunately I was able to do a fellowship and completed 2 years back from the University of Michigan. And also presently I'm working as a faculty at Benta Hospital in Baylor College of Medicine. So I would like to talk about the stroke. So stroke, also called the cerebrovascular accident, sometimes called a brain attack, occurs when the blood supply to the brain is blocked or when a blood vessel ruptures. In either case, the part of the brain that is affected, deprived of the blood, it damaged or dies. So this can cause, the stroke can cause lasting damage and with the resultant long-term disability and death. So depending on the location, so the patient can develop symptoms like loss of sensation to one side of the body, and loss of, as most of you know, loss of weakness, the motor function, memory issues, to the affecting the thoughts, emotions, speech, etc. So the stroke is the 5th leading cause of death in the US, and it's the 2nd leading cause of death in the world. So every 40 seconds, someone in the US develops a stroke, and every 3.5 minutes, somebody dies of a stroke. So every year there are about 800,000 people in the US develop a stroke. So stroke-related costs in the US comes to about 55 billion per year. So 85% of the interesting thing is 85% of all these strokes can be prevented if we have the knowledge how to take care of your health and the risk factors which would cause the stroke. So now the question is, brain is a very important organ, as you know. So for the question to the audience, can anybody tell how many neurons are there in the brain in average? Other than the doctors. Question to youngsters, how many millions or billions of neurons in the brain? So anyway, in an average, there are about 86 billion of neurons in the brain. 86 billion. It's a very complicated, supercomputer that no one can, whatever amount of advancement can, create to the brain like this with, it's a great creation of nature, God. So we have to take care of this brain. So somebody develops a stroke, say like a large vessel stroke. So with this large vessel occlusion, about 1.2 billion of neurons they would die. Per hour, about 120 million of neurons they die. Per minute, 2 million of neurons, and per second, about 32,000 of neurons die. So that's why they say time is brain. Every second counts when somebody develops a stroke. Time is brain. We have to keep that in mind. So, for example, again the question to the audience: say somebody has a stroke, one of your relatives. So you would be at home, somebody develops a stroke, paralysis, and you would call the EMS. You may say would to take about 10-15 minutes. Would you wait for the EMS, or you would just take the patient to your family member to the hospital, nearby hospital? What's your question, your answer? So you would think that it would be more convenient, lot quicker to take the your family member to the hospital, but the recommendation is to wait for the EMS and take via EMS, because the advantages are manifold. When the EMS comes, so once the EMS professional starts attending to your family member or one of the patients, so they would know. Basically, they will ask important questions like the last known normal means. The exact time frame when the patient was the normal and at what time the patient developed stroke. This is very important for the treatment aspect. That's number one, and they would be asking for other things like history of blood pressure, any history of hypertension, any major surgeries, things like that. So this helps, and also once the patient is on the way to the hospital, they would first of all they would know the centers where the specialist centers where these patients will be treated, like what we call the stroke thrombectomy or comprehensive stroke centers. They would know the exact way to take, and so that would help. Plus, they would alert the ER, so the ER folks would be waiting, and at the same time, the EMS professionals, they would have taken all the history and so forth, and alert the physicians, and in that way, the treatment can be expedited. So once the patient quickly goes, you would be evaluated, and the CAT scan would be done. Make sure that patient doesn't have any bleeding and things like that. So coming to so the answer is wait for the EMS. Even if it is like 10-15 minutes delayed, the patient will be better served by taking through the EMS. So next is about evaluation of the stroke patient. So there is one entity, acronym called FAST. So of course we have to act fast. So this FAST, F-A-S-T. Again, there's an abbreviation as well. So the F stands for face. Somebody has maybe in the early the TIA, what we call the transient ischemic attack, in the early part of the stroke. So say patient is developing stroke. How do you evaluate? Act fast. F means face. So basically, ask the patient to smile. So if the patient smiles and the face deviates to one side, then you would know that if there's a drooling at one side, then you would know the patient has stroke. Other thing is ask the patient to raise the arm. So in case of stroke, the arm at the side of stroke, they will droop. So then there's another factor, and the speech would be affected, may not be able to speak. Maybe it is garbled and things like that. So that's one. So FAST, this has been incorporated by the National Stroke Association and also American Heart Association. So it's important to quickly evaluate and call the 911 right away. And also briefly talk about the TIA, transient ischemic attack. It's similar to the stroke, but it's also called the mini stroke or warning stroke. It's also a harbinger of major stroke. So somebody has a mini stroke. A mini stroke can be in the form of just numbness at one side of the body. It will last for a few minutes or a couple of hours, even up to 24 hours. After 24 hours, patient would completely come to normalcy. So when somebody has a mini stroke, that would indicate that there is a chance of developing a major stroke, something like up to 17% within like 90 days, within 3 months. and within a year, about 33% of the patients can develop a major stroke. So even if a patient has a mini stroke, it should be considered as an emergency situation and seek the medical attention. So this can be due to like a severe stenosis in the carotid artery, causing a decreased blood flow, or sometimes a tiny clot can go into the eye, and it can cause sudden blockage of the sudden blindness in one eye, two eyes, sometimes diplopia, again the transient. So somebody again has this mini stroke, it should be considered seriously, and medical attention should be sought immediately. So now coming to the risk factors, what are some of the risk factors for this stroke? So risk factors can be classified into the ones which are you cannot change. What are the factors that you cannot change? Of course, the family history. There is a family history of stroke, and it cannot change, but it gives an idea. Somebody has a stroke, we have to be really conscientious and to take care of our health. That one age, as we age, there is, especially in case of men, as we age, there is increased chance of stroke because of atherosclerosis and so forth. Again, in the men, as I said, again, the female also, as they age up to like 55, 65 years, they will also catch up. The incidence of stroke is higher in case of female as well. And prior history of TIAs, mini strokes, with that, there is increased chance of stroke. And also the one entity called the sickle cell disease. In this patient, there are increased chance of clot formation and increased chance of stroke. What are some of the conditions, risk factors that you can control? So things like high blood pressure, chronic high blood pressure. Blood pressure is the predisposers for atherosclerosis. So this is something preventable, especially if they given family history and things like that. So we have to take care of you call it a hypertension if it is more than, the systolic pressure is more than 185, diastolic is 95. So it's important to have the blood pressure under control. And of course, high cholesterol. So blood pressure and cholesterol combination, there's increased chance of atheromatous plaque formation. So that's one. And of course, the cardiovascular disease, especially in the heart. Say if the patient has a heart failure, heart defect, sometimes if there's a small defect in the atrial septal, the septum between the atria, so the tiny clot from the veins can cross into the left side and it can cause stroke. Sometimes if you don't find any other reasons, so this is called the cryptogenic stroke. In that case, we have to evaluate for atrial septal defects. Atrial fibrillation, in this case, because of the irregular heartbeat, the heart doesn't contract properly, so there's the formation of the clots in because the stasis of the blood, formation of clots in the heart that can go into the brain and cause stroke. So that we have to keep in mind. The carotid artery disease, because of the severe plaque formation and the stenosis, in that case we have to do the duplex ultrasound or even the CT angiograms and things like that. So that will give an idea and take care of if the stenosis is significant, it has to be treated. Of course, diabetes, homocysteine, increased levels of homocysteine, that's the other thing. Excess weight, and in this COVID era, we have seen so many articles, studies that patients with COVID, especially the younger ones, there is increased chance of stroke and heart attacks. So we have to keep that in mind. So, and of course, smoking, physical inactivity, poor nutrition, things like that, heavy drinking. So all these are the risk factors that are easily preventable, and in 85% of the time, they say by attending to these factors, stroke can be prevented. So with this, I will pass on to the next person. Thank you for your attention. So next in the alphabetical order, we have Dr. Devans, Dr. Ulhas. So he's an internist. He did his medical graduation from BMC. As you know, BMC is the #1 college in Karnataka state, well trained. And he is an internist for about 21 years, presently practicing at Denelon, Florida. So he will give some health tips in the general medicine.
Thank you. Hello, I'm Ulhas Deven. I'm a primary care doctor in Florida. I'm going to be talking about adult preventive healthcare recommendations. I'm going to be handing out some pamphlets this applies to pretty much all the adults in this crowd. So, and this is only for healthy people. So, give me a couple of minutes. As soon as they distribute it, it's much easier to follow up. I'll go ahead and start. So, the adult preventive healthcare guidelines, the number one thing is screening is for hypertension. We start screening for hypertension from the age of 18, 1-8. The reason why it's important is it helps in prevention of strokes and heart attacks. And it starts at the age of 18, and the recommendation is to have it checked at least once in 2 years. And the goal is less than 130 or 80 in everybody, all adults. So once in 2 years. The second screening recommendation is for cervical cancer in women. It starts from the age of 21 up till the age of 65, and the recommendation is once in 3 years. And the next one is colon cancer. We start from the age of 45, it goes up to 75. And there are different ways of doing the colon cancer screening. It can be once a year with a stool card, or once in 3 years with a stool DNA test, or once in 10 years with colonoscopy. Again, all these recommendations are for the general population, applies to all adults. Again, the age ranges can vary depending on each individual. If somebody is going to live more than 10 years or 20 years, your doctor may still recommend doing a colonoscopy. And the next one on the list is breast cancer, which starts screening for an average woman from the age of 50, and it goes up to 74 years of age. It's once in 2 years. We also check for osteoporosis in women. This starts at the age of 65, and the recommendation is once in 5 years. So that is mainly about screening for diseases. Now, there are some medications that we dispense for prevention. Number one is statins for primary prevention of heart disease. As we all know, we Indians are higher risk for heart disease. So, usually when you see a doctor, they do some calculations and they calculate your 10-year risk. If your 10-year risk is more than 10%, then we recommend statin medications to prevent heart attack and strokes. And make sure you tell your physician that you're South Asian Indian and your risk goes up by 1.6%. They multiply by 1.6% after the calculation. So because genetically we are more predisposed to it. So if your risk is more than 10%, we recommend statin medications. If your risk is between 7.4 to 10%, we may consider statin medications to prevent heart attack and strokes. Of course, with heart disease, there is also your risk enhancers. If a family history, that means in your family, if you have your parents or your siblings, men less than 55 or women less than 65, is considered to be a family history. So those will also increase your risks. And if you have autoimmune disease, early menopause, that means age less than 45, will also increase your risk for heart disease. So that's about statins. The next thing is about when you take, this is the most recent one, when you take aspirin. In the past, we used to recommend everybody should take an aspirin, but that has changed. The reason being that after a certain age, the risk of GI bleed goes up. So we don't recommend aspirin to everybody anymore. So we again calculate the 10-year risk. If it's more than 10%, between 40 to 59, we recommend aspirin. Less than 10% risk, we do not recommend aspirin. And more than 60 years of age, we do not recommend aspirin in an average person. So that is the most recent recommendation. So those are all the screening and preventive therapies recommendations as of today. This is an ever-changing concept. So, this may change in the future. So, if you can follow with the pattern that I gave you, the United States Preventive Services Task Force, they keep up with all those things. Thank you.
Thank you, Dr. Devan, for that good information. Next, we have Dr. Sudha Kannavar. She is MD and OBGYN. She is a professor of clinical medicine at American Medical University at Caribbean Island. She and her better half, Dr. Nagar Mysore, of the power couple. So they have the best of both worlds, practicing medicine as well as living in this exotic world, Caribbean Island. So she will talk about the adolescents and women healthcare. Dr. Kannavar.
Good evening, everyone. For the past 2 days, I've been seeing all beautiful ladies, and I don't know, for some reason, yesterday during the musical event and today morning, I see the beautiful, lovely young girls walking around here. So I thought, let me talk to them, speak to them, connect with them. Are you all ladies ready? For 5 minutes only, not much. All right, now.
The men go out.
When I will go, you're going to appreciate all the ladies here. All right, okay. What I would like to tell is women empowerment. Women empowerment is not just with abortion rights. It is a woman empowerment should happen with the woman taking power of their reproductive health. Having said that, when does it start? It starts at the adolescent age, when they start exploring themselves, their life in the future. It's a planning, don't you think so? And that's the age when the hormones kick in. They want to admire the beauty. How? Admire the beauty of their own body. That's how I feel, that's how I felt. I believe the youngsters feel that as well, which is perfectly fine. It is, when the hormones is kicking in, you need to admire your own beautiful body, mind, and it's okay. It's okay to surrender to another person, trusted person, admire the person around you. That's immaterial to the sex, immaterial to the whatever it is. So it is okay. Admire the beauty, admire the universe beauty, inner beauty, and the beauty of the body which we have. So, having said that, when you are in that phase of life, you got to think of 2 things. Do I need to become pregnant? Attitude towards the pregnancy. What is the attitude towards the pregnancy? Do I need to become pregnant in the future sometime? Yes. If it is yes, so think, when should I become pregnant? Time it, okay? When you time it, it means that if you are sexually active, you need to have a contraception plan going ahead. How will you plan it? Very simple. I will tell you. You plan it, make sure that you find the right partner who's trustworthy and proceed ahead. Then, how will you plan for contraception? You plan for contraceptions, it should be safe, it should be effective, and it should be convenient for you to take the medications or go with the planning, whichever that you want. Fair enough? Fair enough? Alright. Now, sometimes, especially teenagers or youngsters, youngsters may be around 15 to 19 years of age. Believe it or not, 30% of them have a chances of becoming pregnant. It is unintended pregnancy. Outcome is not that good. 10% of them will abort, 20% of them will go ahead and give birth. It is unintended pregnancy, has a negative impact on a girl, on a family, on a society, which is not good on the long term. So, feel free to speak to your parents. That's what I would like to tell you. Be open-minded. Parents, please feel free to listen to your children. Support them, acknowledge them, support them as it is needed. And another thing I would like to tell you is, any minor girl between the age of 15 to 19, you still have a right for contraception without the parental consent or notification. So, please talk to the parents, seek their help, go to the clinic, seek for contraceptions. Okay? Sometimes, if you go to the clinicians, do I need to get the pelvic examination done or a uterine examination done? No need. If you are taking oral contraceptive pills or injections or a patch, you don't need pelvic examinations. Sometimes they may do ultrasound, that's more than enough. But if you want any contraception to be put up in the uterus, then only you need doctor's examinations. So you have a choice. You want a pelvic examination to be done? No need. So go according to your wish, according to your decision with your parents or with your loved ones, whomsoever you want to talk. Alright. Now, this is all about the planned contraceptions. Sometimes you never know. You might end up in a situation having a sexual intercourse, then immediately become scared, you don't know what to do. The next plan is move on to emergency contraceptives. Very simple, very simple. The rule is 7 days and 5 days. If you had a sexual intercourse within 7 days of the first day of the last menstrual cycle, if it is within 7 days, chances of pregnancy is very less. Start the oral contraceptive pills. If it is more than 7 days, get the urine pregnancy test done and proceed accordingly. Having said that, proceeding accordingly means if you had a sexual intercourse within 5 days, still you can go for emergency contraception. If it is more than 5 days, please contact the doctors. Clear on that? Clear on that? It is in your hand. Please proceed with that. That is what I would like to tell you. Alright. Any doubts? Any questions you would like to ask? I can take 2 questions. Yes, the little one. I would love to see you soon, darling. You are so pretty though.
That was an excellent question. Thank you. Thank you, Professor Kannavar. Thank you for touching on this very sensitive and important topic for all of us. So next we have Dr. Raj, Shekar Raj. So Raj is a pediatric intensivist and also is a ECMO director at Bismarck Children's Hospital, Corpus Christi. He works at urgent cares also. So he's a residency in pediatrics from SUNY Brooklyn and his fellowship in the pediatric ICU is from SUNY Buffalo, New York as well. So I know Raj, I heard about him about 10 years back. So I was introduced by a mutual friend, Anil Kumar Ram. So he introduced me, so you see this is Raj and he's a gold medalist in his pediatric post-graduation. So Raj, as you see, he's a highly and well-accomplished pediatric intensivist, and he will talk about some of the general health tips about the children. Raj?
Okay, good evening everybody. So, I was when Amaresh contacted me to talk about something in pediatrics, I was thinking that okay, I'll just give some common advices and common problems we encounter regarding the care of our children. So, because I did my fellowship in pediatric ICU, before that I did pediatrics, and After that, I have practiced general pediatrics in a rural area. Then I work in ER and urgent care, and also I practice ICU. ICU is kind of ultimate primary care, so you kind of see everything. And also I see the common ailments which they come to the emergency room and urgent care. So I thought initially, like when I was doing ICU, you will not focus on the concerns parents have on their children. So I thought giving like some of the common concerns which may seem very big to them, and also I see a lot of misconceptions from family and parents also. So I thought I'll talk about it very briefly. So one of the common thing obviously is vaccinations. So I think pediatricians are pretty good in following a vaccination schedule, and they do vaccinate children very well. But one of the things which parents always ask us is the relationship between autism and vaccinations. So there are some people sometimes, actually in America, there are groups, anti-vaxxers, they call them. So they spread a lot of information against vaccines. So there is not really any truth to it, and there was one original paper came in Lancet associating vaccination with autism. That's all false, it's all made up data they published. And if you look at the incidence of autism in vaccination and unvaccinated children, there is no difference. So my strong recommendation to all of us here is to go and vaccinate your children. And you can look at the vaccination schedule in the CDC website, it gives you all the vaccination. One thing I want to tell you is that if the kids are going to the college, they need to get vaccination for a meningococcal vaccine. So it's a meningitis, so that's very important. Then the other thing I was thinking when I was talking to somebody, when people were talking, I was looking up the vaccination schedule here in US and in India. And when I was doing my pediatrics in India, I saw a lot of kids with encephalitis. That is actually infection in the brain, which can cause devastating effect. So if you can look, it's common in Ballari area, North Karnataka area, and some of the areas where summer and fall, where they grow a lot of rice and a lot of water, where the mosquitoes are there. So when you have Japanese encephalitis, around 30% of the children die, and remaining out of 70%, around 60% will have significant neurological sequelae. So one thing I was thinking that if you think that you are going to stay there for at least more than 3 to 4 weeks, it's better to get Japanese encephalitis vaccine, which is available, and you can request your pediatrician. That normally they don't give it, but in case if you are going to stay there long and if you are going to this area, you should give it. So that is about vaccination. Then other thing which normally we see is that respiratory infection. So you have a cough, cold, and kids having fevers, and people come to the emergency room when they're in care. And even my wife sometimes asks me, what are we going to do? My son is having this. Most of the times you don't have to do anything. So whenever they get the respiratory system, the infection, if they are very small, it's all mechanical. So you have a lot of secretions, the nose gets blocked. If they are small children, only thing you need to do is that you put saline drops to the nose and keep suctioning the nose and keep the airway clear. Most of the time they do get better. And only thing you have to watch for if they are small children, if they are breathing fast, if they are not feeding that well, you need to take them to the doctors and they can decide whether they need to be admitted and just do supporting care. Most of the time there is no definite treatment, just all supporting care and they get better on their own. And sometimes, if their nose is very much blocked, sometimes you can use a decongestant. You can get, if they're a little bit bigger kids, more than 2 years old, we get something called aspirin nasal spray. You can use it, but not more than 3 days. So it will kind of acts as a decongestant. Then the other thing is that, so people always ask, what is the best cough medicine? What can I give for my children? My child is coughing all the time. So, fortunately, I also deal with the doctors who come to bring their children and they want something to be done. So, according to American Academy of Pediatrics, they don't recommend cough medicine for children less than 2 years of age. So, we don't normally give anything. Initially, I used to be really reluctant, it was very difficult to convince parents not to do anything. They always say, I came to a doctor, you have to do something. So it takes a lot of patience and educating parents because most of the time cough medicine doesn't help, but they can cause side effects. So So one thing you have to say is that if they're a little bit bigger kids, if they're coughing a lot of times they will have something called wheezing, like a chest cold. In that case, you can use short-term inhalers like albuterol inhalers. That helps. Otherwise, cough in the help. Then another thing is whenever you have respiratory infections, other thing obviously worries the parents is the fever. So there are a lot of misconceptions about fever too. So a lot of people say, oh, the fever is very high, it can affect the brain and things like that. So usually fevers are okay, but it needs to be treated. So sometimes there are some doctors who believe that fever should not be treated, and you can read something about on the internet and things like that. But it should be treated. One of the things is that high fevers causes a lot of discomfort, body ache, and it kids lose their appetite. And so if you control the fever, the appetite comes back a little faster. Then in the kids, they are 6 months to 6 years of age, they can get seizures. They are called febrile seizures. And most of the times, if they have febrile seizures, you don't need to do anything, you have to control the fever. Obviously, if the seizures last for more than 2 to 5 minutes, you need to take them to the hospital. And we need to evaluate whether they're simple febrile seizures or something else is causing their symptoms. So if the seizures happen before 6 months or after 6 years, it may not be febrile seizure, even though if they come with fevers. So it could be a seizure disorder, or they have family history of seizures and they get fevers that can provoke initiate seizures. Then you need to take them to the doctors and we need to get them tested and see what else is going on. So that's about like respiratory infections. And one of the common causes of fever in pediatrics is respiratory infection. So if you are breathing fast and if they are working hard, then you have to take them to the doctors. Sometimes we have to give them oxygen fluids, and if they have secondary infections, we will give antibiotics. Any questions so far on those things? Because these are common, yes?
Yeah, preventive medicine, what you take.
Yeah, okay, good question. I was planning to tell. So, most of the time, you have the two medicines which you can use, Tylenol and ibuprofen. And usually, how much you give is there on the bottle. So, Tylenol you can give every 4 to 6 hours, and not more than 5 or 6 times a day. And ibuprofen you can give if they are more than 3 months of age, every 6 hours, not more than 4 times a day. If the fever is more than 102, you can give both of them together, so to get the fever down. Then the other thing you can do is that you can also do the sponging of the body, and do not do cold water sponging. So how the sponging decreases the temperature is, the body evaporates the water and the temperature comes down. So you need to sponge them with the lukewarm water or a normal body temperature water. Then the other thing is you can just give them a bath. So just regular bath, and you can give more than once or twice, even 3 times a day. So actually that makes them feel better, and also is hygienic. There's a lot of secretion from the respiratory tract, and sometimes they have warm throat, sometimes they have diarrhea, so it cleans their body. Then one more time up. Okay. Just one. So I will probably take one more minute. So other thing is that children feeding. So breastfeeding is always best, and try to give breastfeeding as much as possible up to 1 year. And after 4 to 5 months, you can start giving baby food. Then the one other thing people always come, parents, is that, oh, my child is slim and is not 50th percentile. Previously, American Academy of Pediatrics used to recommend that they have to be at 50th percentile, but new recommendation is as long as you are 25th percentile, around that area, you should be good. It means you should be on the leaner side, not on the middle side or upper side, because most of the time, children used to gain weight when they become teenagers or more. Then other thing I want to talk about is the cleaning of the mouth and the teeth. Now, when do you go to the dentist? So usually, by 1 year, you should have at least one dentist visit. Once they start having primary teeth, around 6 to 7 months of age, you should probably see a dentist to prevent the decay or something like that. And also, it's important that you should have fluoride in the diet, or sometimes if the fluoride deficient area, you can get fluoride application for the dentist. Then other thing is you can start cleaning the teeth with just a clean gauze or a soft toothbrush. Then less than 2 years, 3 years of age, you just a little bit of toothbrush and paste on the toothbrush, and you can clean. After that, maybe a peanut size toothpaste that you can clean the mouth. then it's very important to brush the teeth twice a day, once in the morning, once at night. And even for adults, it's very important to floss your teeth. So always floss your teeth at least once a day before you go to bed. Then one other thing I wanted to talk about is the exercise and the drinks, So whenever you have an exercise, if it's less than one hour and it's not very intense, just the water is the best drink. The soft, the Gatorade and all, even though there's a lot of advertisement, is of no use. Juice of no use. So a lot of times I see the kids, they come to the gym, they do 20 minutes of exercise, they drink a lot of sports drink, and their weight is not going down. You know what? Because sports drinks have a lot of sugar, and it gives a lot of calories. Then most of the times when you have vomiting and diarrhea, don't give fruit juices, because a lot of any sugary juice or a Coke makes diarrhea worse. Then one last thing about head injury, So if you have a head injury, a lot of times people fall and people get worried. What do? If there is a fall, if they don't lose consciousness, if they're acting normal, you don't really need to do anything. But if there's a loss of consciousness, or if they start throwing up persistently, one vomiting is okay. If they start vomit more than 2 or 3 times, projectile, or any change in consciousness, you need to take them to the emergency room and you need to get their head scan. Okay? So this is a small tips in pediatrics.
Thank you, Raj, with the vaccination instructions and also the excellent tips for the pediatric patients. So next we have Dr. Sudha Prasad. So Sudha auntie, she's a family practitioner she's in private practice for nearly 40 years. So she finished her medicine in 1972. She has a lot of experience and wisdom. So she did her family practice residency from Mehari Medical College, and then she has been working in Memphis, Tennessee. She was the department chair for 3 times. She was on multiple committees at the St. Joseph Hospital, department representative for 2 terms. She was at the Baptist Memorial Hospital as well. So a lot of experience. So she'll be talking about COVID and vaccines and so forth. So here is Dr. Prasad.
Thank you. Today I'm going to talk about COVID-19, overview of it, and then touch upon the vaccination. And also we'll touch upon the symptoms, how soon to detect the disease, when to suspect the disease, even if the test is negative, when to retest. A few items so it may exceed 7 minutes. Let me know if I have to stop. Okay. COVID-19 is COVID virus disease 2019. That's simple. And it is a pandemic that affected the whole world, loss of lives and financial loss and poverty-stricken countries, extreme and unmeasured. And the pandemic is not that is the take home, but the seriousness of the infection has reduced as well as hospitalization and economic expenses involved with taking care of the patient and long-term disability has reduced. The survival is high with the available treatments. Worldwide, more than 600 million people were affected, 6.5 million or more have died. And in the United States alone, more than 1 million people have died, of course with comorbid conditions of heart disease, diabetes, respiratory diseases, and stroke and other diseases. In the United States, 2/3 of the population has received at least 1 vaccine, and 50% has achieved full vaccination. That includes primary series and the booster. And there are 4 vaccine manufacturers, including Pfizer, Moderna, Johnson & Johnson, and Novavax company. But the most commonly used vaccines are from Moderna and Pfizer. How it spreads and what to look for. COVID if you're exposed to an infected person, you can get the disease within 3 to 5 days. Some may get it little sooner, and some may be totally asymptomatic. Most people chills and body aches, but there are some people who develop more serious symptoms such as respiratory distress and mental confusion. And these are the people we have to think about who will need emergency room visit and possibly hospitalization. Nowadays, with the availability of the vaccines and testing, it is less so needed for admissions, and most people are getting vaccinated. The prevention and treatment starts with prevention of the spread of the disease. The moment we feel sick with common cold-like symptoms and get worsened over the next few hours, it may be time to get tested. There are lots of tests available in drug stores across the country. Within 15, the result. If it is positive, you have to quickly isolate yourself and put the mask and wash hands and keep